Any physician, any skillful physician who's going to treat a patient, provide treatment to a patient, then he or she is going to take into account these 20 matters.
Over my shoulder, I see a clear view.
Assalamu alaikum, this is Anika Aslam and I'm starting my own YouTube channel. For the purpose of this channel, there is going to be an introductory video to the channel and to me as well. But for the first video, I actually wanted to jump right into one of the things that I want to cover on this channel and I want to talk about. And that is medicine of the Prophet, Salallahu wa Salem. And for that, I really recommend to any of the physicians, any doctors, dentists, anybody who has anything to do with the medical field, with the patients, and in general you treat patients, you help patients. So I really recommend that you read Medicine of the Prophet by Ibn Qayyim. It's a book I've been reading recently, and there are so many things that I've come across that I want to share with everybody, and I want to make it common knowledge for at least the people around me, inshallah. So for today's video, we are actually going to be covering something from that book. So first of all, this is what the book looks like, and you can get it from anywhere. So this is the book, and it's an amazing book. It's beautiful and it's important to read. You can read about Medicine of the Prophet from other places, from other resources, but this is genuinely a good resource as well. What we are going to be covering today is characteristics of a skillful physician as they are in this book, and they are mentioned in the chapter number 26 of the book, and it has other there are other things that this chapter talks about. But when I read these characteristics of a skillful physician, one of the thoughts that I had immediately were that I want to share these with others as well, especially my colleagues. So there are 20 things that Ibn Qayyim has mentioned here, and first of them is diagnosis of the illness, identifying its category. As we've studied in our books as well, that there's a whole set of things that you really need to do before you reach a diagnosis, right? So first is diagnosis of the illness, and second is consideration of its cause. Where did it strike at first, and what is the effective cause? So cause of any disease is so important, and it's advocated in Western medicine as well, which we derive most of our knowledge initially from. Identifying the cause is as important as providing treatment eventually to the patient, because that really helps you provide the right treatment for the patient. Third is the strength of the patient, his physical resistance, his weak points, and if such resistance can withstand and overcome the illness. If so, he lets his body deal with the illness and does not stir it up. So when I read this, I felt like this is something that I personally have not stressed upon a lot when I end up treating any of my patients. So the little experience that I have for now in treating my patients, I think I have neglected this sometimes due to the lack of importance I see being given to this even around me. What is it that you look at the patient and you try to figure out if the treatment you're going to be opting for is actually something that the patient can take or not. So you look at the strength of the patient, and it's so important. So for example, if the patient is old age, and I'll give an example from dentistry. So for example, a patient is in old age, and you plan implants for that patient, but then it's such an age that if you let the patient go through that surgical procedure and that stress, it's better to let them have a complete denture, because the few years that they may have, there's no use putting their body under so much stress. So you decide your treatment plan based on just the strength of the patient, like that. On the other hand, if it was a young patient, you would like to tell the patient to go for definitive prosthesis whenever possible. So Looking at the strength of the patient is so important, their physical resistance, whether or not they can take the treatment that you're going to provide him or her. Fourth one is the natural temperament of the body. And the natural temperament of the body has been talked about in this book at other places as well, and we will go into its details. But that is something that you really need to keep in mind and ask some questions about it to come to a conclusion. The changes to the normal temperament. So what are the changes that you see in that normal temperament? So you see the patient as a whole. And sixth is the age of the patient, of course, and so important. If you have been seeing patients, and you have seen some patients at least, and now you are working on the clinical side especially, then you know how important the age of the patient is. So for example, sometimes we plan extractions, or we even defer any kind of treatment for a non-problematic, non-symptomatic tooth in a young patient, because we want to maintain space for the succedaneous tooth coming out. So we make decisions, a lot of decisions based on the age of the patient as well. Seventh is his habits. So what are the habits of the patient? And by habits, by large, we mean a lot of things, especially in dentistry. There are a lot of things that we ask in habits. They really change the way we look at our patients. So for example, if the patient is a habitual smoker, then while providing even a simple treatment like scaling, we would like to emphasize more on hygiene and on telling the patient to frequent to the dentist even more and get more regular scalings done, and also to immediately after the procedure, at least for some days, stop smoking, because otherwise they will not see the same results and they're going to complain later on. In terms of the health of their gums especially, because that really changes in a rather shorter period of time compared to the hard tissues of your teeth. So the next thing is the season of the year and what is appropriate to it. So I believe that I myself have very little knowledge about this, that you take into account the season as well. So and honestly, I really want to ask you guys listening to this right now, if there's anything regarding seasons, any practical example that you've come across, especially in dentistry or even in medicine as well. Why not? I would really like to hear, because I am trying to learn more about this myself, and although I feel like I can come up with some examples, but at the same time I can't find something very convincing which helps me understand this even better. Because in terms of seasons, we do understand how diseases happen, but in terms of providing treatment, how are you going to take into account the different seasons? So for example, there are diseases that will only happen in certain seasons, so that helps you in diagnosis, but how does it help you in changing your treatment plans? And but it's important, of course. So ninth one is the patient's homeland and environment. So where does the patient belong to? Especially in COVID, we figured out the importance of history of travel, history of the locality they are from even more. So it's important in every patient, to be honest. Next is the state of the atmosphere, polluted or otherwise, at the time of illness. So what is the state of the atmosphere that patient is living in? Is it a polluted environment they're coming from? For example, is their water polluted in any manner, or is it not okay, or is it what is causing any kind of illness to them? So now I also think of an example in dentistry. So we get patients of fluorosis who have it because of one big reason sometimes, which is that their community water supplies are either not fluoridated, or their diet is such that they're facing it. So where they belong to and their locality, their atmosphere over there, if it's polluted, if anything in their atmosphere is polluted, that plays a huge role. 11th is consideration of the medicine which is opposite to that illness. So you consider a medicine which is opposite to that illness, of course. And next is considering the strength and degree of that medicine and the balance between these factors and the strength of the patient. Okay, so while you read this book, you will realize it talks about treating diseases with something that is going to be the opposite of that. So of course that is very simple to understand. So if something is wrong with the quantity, quality, frequency of any of the things inside the body, which is now leading to derangement from normal and causing the disease, you take care of that by adding something that has the opposite effect of what is going on in the body that has caused the disease. So similarly, you choose a medicine that you consider the strength and degree of that medicine and the balance between these factors and the strength of the patient. So you don't prescribe the same medications for same disease to all the patients. You actually consider the strength of the patient as well, and which medicines you can give it to them, which you figure out by taking a detailed history and understanding the patient and where they're coming from, the seasons and the strength of the patient and the age of the patient and the habits of the patient. Okay, so next is the whole aim of the physician should not be restricted only to removing that illness, but to remove it in such a way that there is no danger that something worse might result. When its removal is not free from the risk that another worse illness might occur, he leaves it as it is, and it is necessary to deal very gently with it. This condition is like the illness of the mouths of the veins, for which this is treated by cutting and restricting them. There is the risk of something more serious occurring. So you do not treat something if you you do not treat something if you feel that something worse is going to happen by providing a treatment for that. So for example, if a lady comes into your dental office who is in her first or third trimester, and you would like to provide them a treatment which is not an emergency, so you fear that you might have to prescribe medicines to that patient post your treatment which can be teratogenic, so you don't provide that treatment to the patient. You inform the patient well, and you send them back. You don't do that because you don't want to cause further problems for the patient just by treating something that was not even an emergency, dental emergency. So next off, so you want to provide an endodontic treatment to your patient. You wouldn't really do that if that patient is coming to you with a big swelling on the side of their mouth. You're not going to be doing that immediately, because you're going to be first going for an empirical therapy with some kind of antibiotics, or you're going to drain that first, and you know that even the anesthesia won't be effective and it's going to cause a lot of pain to the patient while you perform that procedure. So you defer the treatment then, and then you recall the patient. God knows best. I hope there were some learning points for you in this, and there were things that you were able to take away from this video of today. Please let me know if you would like to have more videos about this particular topic, and also if there are other topics that you want to see me covering in my videos in future. Also, if you have any recommendations regarding the running of the channel or anything in general, I'm always open to any ideas, always open to any suggestions, any critique, any good or bad things you would like to say, you would have to say. Thank you so much for listening. I was thinking if I need to say that please like, share, comment, subscribe, but then I was thinking that I think everybody knows the drill and we don't really have to make it a thing at the end of every video, do we? Okay, maybe. I have no idea. So thank you so much for listening. I just hope that it was a good utilization of your time and you found something beneficial, because that is the only reason that this video is here in front of you. Have a good day.
All for my family, reason I'm breathing.